Hi there, this is Dr. Paul and thank you so much for watching this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about post-operative tooth discomfort. Now this is a long-winded way of saying your tooth hurts after any dental treatment has been rendered to it. To understand why this happens, we need to talk about what exactly a tooth is. A tooth is a biological entity which has a crown and a root. Now the crown is over the gum line and the root is below the gum line. The crown is enveloped by a layer called enamel, and enamel is the most acid resistant and the strongest mineral that we know of the human body. Enamel is made out of enamelinin and amelogenin, which are two minerals or enzymes that are made by a reduced enamel epithelium, which is the organ responsible to form enamel. Now the caveat is as soon as the tooth is into the oral cavity, that enamel forming organ disappears, and this is also the reason why most dentists are very conservative with their approach about drilling a cavity into a tooth to remove decay or drilling the tooth down to do a crown preparation. Now enamel is 98 to 99% inorganic, which means it's pretty much all minerals with very, if anything, moisture. This is also why bonding is extremely strong towards enamel, and that is basically why we always try again to keep as much enamel as possible. Dentine, which is the second layer of the tooth, is a 75% inorganic and 25% organic entity. But the biggest difference between enamel and dentine is the fact that dentine has a lot of micronerves which transmit nerve impulses from the tooth to the nerve, which is the pulp chamber inside. Dentine also has a lot of moisture, which is also the reason why the bonding in dentine is not the strongest. Why we always try to save a lot of dentine or dentinal tooth structure is so that we have a bulk amount of material to put our filling into, but more importantly, we are trying to conserve as much tooth structure as possible. Now, the inside of the tooth is the nerve chamber, which has something called the odontoblasts and odontoblastic processes. And these are basically your nerves that have extensions or little live wires that go from the inside towards the dentine. This is also the reason if you have a small chip or a small cavity, you'll probably never feel it because it's still very much in enamel, and that's also why when we take an x-ray and we see and tell the patient, look, we have a lot of baby cavities, you really need to brush and floss more diligently and use some fluoride toothpaste or mouthwashes, and you should be okay rather than us drilling into the entity. Now, whenever we do a filling, you're drilling into the tooth. Now, when you drill into the tooth, you're taking a drill which has heat, water, and vibration, and you're inflicting a lot of micro trauma into the tooth. Inflammation is the body's resistance or counterbalance towards any kind of trauma. Inflammation has four Latin-based named responses, which is rubor, tumor, calor, and dolor. So rubor basically means redness, which means if you bump your skin or you get hurt, you will see redness on that part of your body. Tumor means swelling, calor means the increase in heat, and dolor basically means that there sometimes might be loss of function of that part of your body. Now, the reason that tooth hurts a lot when you get a cavity or when you have any kind of drastic trauma is because the nerve inside a tooth is going through all the four stages of inflammation, but the nerve inside is packed in a hard shell, so it has no place to swell up. And this is also the reason why the apex of the tooth or the root part of the tooth is very critical in getting blood that will re-energize or heal the innard of the tooth. In time, what happens from chronic irritation with either cavities or with multiple fillings done repeatedly, you have something called sclerotic dentine that forms on the inside of dentine. So remember what I said, enamel can never be regrown, but dentine can. Now, there are three kinds of dentine. There's the primary dentine, which is dentine that's formed in the tooth bud before the tooth erupts into the mouth. Secondary dentine, which is dentine that is formed once the tooth is in the mouth, it usually goes on for 2 to 3 years after the tooth is erupted into the mouth. And then there is something called tertiary dentine. Tertiary dentine is the most important reason why tooth sensitivities after any kind of cavity prep or crown prep is transient. Tertiary dentine is something that is laid down by the pulp in increments, and this is the reason why a lot of times your tooth might be sensitive after a deep cavity preparation, but given it enough of time, usually your tooth bounces back or feels better. Now this is compared to or conditioned to there is no high spots in your filling, which almost is comparable to having a pebble in your shoe and you pounding your foot on hard concrete. So that's called a high occlusal spot. That's a little different from tertiary dentine formation, or the causation is a little different, but we'll get to that. Now, as far as when we do any kind of crown preparation or bridge preparation goes, we tell the patient, look, we just don't know how the tooth is going to bounce back, even if it will bounce back after a crown or bridge preparation. And this is because sometimes the tertiary dentine, which is the version of dentine that's formed inside the tooth from chronic irritation, will not let the nerve heal from the strangulated blood chamber at the apices. This might be a little confusing for you to understand, but think of it this way. Someone who is in their 18s to 20s and someone in their 50s to 60s, when you look at both their the tooth in an x-ray, you will notice that the younger person has a big pulp chamber or big nerve chamber, but the older person has a very constricted pulp or nerve chamber. Now this is because with age and using the tooth, you will definitely have more and more tertiary dentine layers formed, and this also unfortunately causes the apex of where the blood supply comes from to narrow. So this is the reason why young people, when you do any kind of deep cavity preparation, they might have more sensitivity, but they also heal quicker. Just like with everything else in life, when you're young, you have more get out of jail free cards. But unfortunately, when you grow older, that is limited. This is also one of the reasons why we constantly tell our patients, look, there's only so many times you can keep drilling and filling a tooth, and there will always be consequences later on in life. And that is why it's important to realize that a crown preparation or a bridge preparation is done not to wound the tooth, but to help it get better long haul. But the consequential sensitivity is something we just can't avoid. I know this is a lot of information I'm throwing at you, and hopefully these photos are helping. If you have any questions or if you have any comments, please feel free to call us at 613-966-1225. Thank you so much for watching.